This device that I'm holding right in front of you is called a plasma pen. This is a remarkable technology that is used in facial aesthetics. It's a wonderful tool to recreate someone's face. And today we are going to learn something about this particular plasma pen. What is the technology behind it and how it works and what are the results. So keep watching. What is plasma pen technology? Now let's have a look into it. First thing first, what is plasma? Plasma in ancient Greek means moldable substance. We know that matter exists in four fundamental states: solid, liquid, gas, and plasma. When a high energy is delivered to a gas, plasma is produced. The high energy dissociates the molecules and the atoms of a gas. These results in the electrons being released and sometimes protons. This creates a cloud of charged particles, mostly containing electrons. This cloud is called plasma cloud. Plasma is a cloud of charged particles in any combinations of ions and electrons. Plasma is the most abundant form of ordinary matter in the universe, mostly in stars, but also dominating the rarefied intracluster medium and intergalactic medium. The sun is made out of plasma. Even the lightning that you see is plasma. The northern lights are plasma. Plasma can be artificially generated, for example, by heating a neutral gas or subjecting it to a strong electromagnetic field. Some of the eye-catching neon lights are also plasma. Other examples of artificially generated applications of plasma are the plasma television, plasma etching used in many industries. Similarly, a plasma pen is a device used in aesthetic treatment. This is a plasma pen. It has a power button. When I switch it on, so we have the power 1, we can increase the power of the charge that we are going to create. Let me tell you that this is the shoot button or the on button. If I press here, then what happens? The inner circuit, the electrical circuit that is inside, will create a very high voltage at the tip of this pen. The air that is present around the tip of this pen, which contains nitrogen and oxygen, will dissociate into plasma. This is a schematic diagram of a skin where we have the superficial surface, that is the epithelium, and the deeper portion called the dermis. There you can see the collagen protein fibers, the fibroblast, and the sleeping fibroblast known as fibrocyte. Whenever plasma is fired from a plasma pen needle onto the surface of the skin, the solid epithelial surface sublimates, which means the solid epithelial cells convert directly into gas without passing through liquid state. This is called sublimation. An example of sublimation is dry ice or frozen carbon dioxide. Solidified carbon dioxide transforms into carbon dioxide gas without forming any liquid. In response to any injury, these fibrocytes, they convert into fibroblasts. The fibroblasts now starts producing collagen. This collagen is an important protein that helps in the repair of the tissues, especially the skin. The sleeping fibroblasts and fibrocytes gets activated and becomes fibroblasts. These fibroblasts produce collagen, which helps in healing. Here we can see the plasma pen in action. As you can see, the needle tip is producing the plasma arc, which is causing sublimation of the skin tissue surface. Just watch that the plasma pen tip is not touching the skin surface. There should be at least 1 millimeter of distance between the plasma pen tip and the skin surface. Here we have a patient with a black nodule around 10 millimeter in diameter, just below the right lower eyelid. He wanted it removed purely for cosmetic reasons. I decided to go ahead with plasma pen ablation for this case. Here you can see the result on the post-operative day 1. There's a flat sore at the treated site. By post-operative day 2, we can see some crust formation with some mild swelling around the edges and a slight reddish halo. Now, moving on to the next post-operative day 8. The size of the treated area has noticeably reduced and the scab is still present. At post-operative day 22, only a minimum barely noticeable scar remains. And now at post-operative day 38, the scar has completely disappeared, blending seamlessly with the surrounding skin. You'd never guess there was anything there. Here's a quick look at the before and after. Pretty impressive, isn't it? The plasma pen really did the magic. This plasma pen looks like a rocket and it's set to fly off. We were basically using star level science for our skin, and the results speak for themselves. I hope you liked this video. Thanks for watching, and if you have any questions, do not forget to drop in a message to me. I'll definitely answer back. So signing off for now, this is Dr. Saikat Saha, maxillofacial surgeon. Take care.